Into our health and tech articles of the day. Sunshine kills the virus. Myanmar, new robots, and Hong Kong technology. Let's get into it. To the next article of the day. Homeland Security scientist confirms that natural sunlight kills coronavirus. Now, this is a little interesting. Besides people like Dr. Ron Paul, who's been saying this from the beginning, if this is the case that sunlight could kill it, then why are not sunbathing tan rooms like exploding with people? Because, right, isn't that what they are? They're like the artificial light to make your body warmer. Because most likely this will tell you the Celsius heat will kill the virus. Because we've known that for months, that if it was like 50 Celsius, it would kill it. Anyway, let's get into the article. The best and simplest cures for the Wuhan coronavirus might just be going outside, as natural sunlight contains ultraviolet rays, and Department of Homeland Security (DHS) scientist with technology advisor Williams said. During this recent press briefing, the White House Bryant explained that UV rays from the sun are powerful antagonistic against the Wuhan coronavirus, incubating its ability to survive, let alone hold and spread. If you remember a few weeks ago, they were saying that ultraviolet lights, like those lava lamp lights and other ultraviolet lights, those actually killed the virus too. I have a video on that from like 2 or 3 weeks ago. A study that looked at 3 different types of UV lighting given off by the sun, A, B, and C, found rays that the UC in particular destroys certain types of generic material in humans, including the viral particles. Based on the study, found that UVC lights can effectively immaculate microbes in the Wuhan virus. Our most striking observation to date is the powerful effect that solar light appears to have on killing the virus, both on the surface and in the air. So the funny thing about this is, the sun is outside, so why are people locked in their houses? We want you to get sick, right? We don't want you to go to the park. We don't want you to go to the beach. We don't want you to go to the football field. Nope, we want you to stay inside in a box where the virus can spread. All right, so we have seen similar effects with body temperature and humidity as well. We're increasing the temperature of humidity in both, generally less favorable to the virus, he added. In the ordinary 70 to 75 degree Fahrenheit environments with 20% humidity on a non-porous surface, the half-life of the Wuhan virus is about 18 hours. Increasing the humidity to 80%, however, decreases it to 6 hours, while adding natural sunlight in the mix decreases it to just 2 minutes. Wow, that's a big killer. This would suggest that simply being in the sun more can help to reduce the risk of the Wuhan virus, the infections and transmissions. The virus simply cannot coexist with the natural sunlight. So America locked people up and lost trillions of dollars, not just in current activity, but in debt spending packages, because they were afraid to go outside. Congratulations. That's a big business failure thinking. Hospitals already use artificial UVC lights to sterilize equipment. Artificial UVC lights is already used in many hospitals to sterilize surgical equipment and surfaces. It is also used to clean airplanes and factories. As a scientist shows, its potentially harmful microbes are unable to survive its presence in any substance length and time. In the case of the Wuhan virus, the verdict will surely be that more testing is needed to determine the UVC light and necessary to destroy, and also remains to be seen how much time one would need to spend in natural sunlight to be free. Alright, so I'm going to kind of stop there. But what do you think about this? And do you think it was a mistake for the governments to lock people up versus going outside in the sun? leave your comments below. Again, this has been known for a long time that heat and sunlight would kill it, but people were just too afraid. But all right, like, comment, subscribe. To Myanmar. In this case, past few weeks we've had a few countries make medical equipment. Now Myanmar is joining the fan club. Myanmar universities invent robot to prevent spread of COVID-19 in hospitals. If you remember, I have a clip above of where Vietnamese had the robots that would go around and they would disinfect the floor and clean the room, and they'd refuel themselves. But let's take a look at this one. Two locally designated and manufacturing robots that may help prevent the spread of COVID-19 have been developed at the makeshift Pyongyang Convoy 19 Medical Center on the outskirts of Yangon. Yangon is in Myanmar. The robots will be used to transport food, medicine, and trash at the medical center, reducing the contact between health care workers and patients and lowering the risk of spreading the coronavirus. One robot, called the trolley robot TR-201, was invented by the Microscopic Engineering Department at Yongtong Technical University and consists of a rolling drink trolley outfitted with sensors so that it can move along the path automatically, eliminating the need for a person-to-person contact. The other robot, the container robot, the CR-201, was invented by the Mechanic Engineering Department at the Madoe Technological University and can carry items in a container or basket. The idea to convert the robots came from the senior professor Dr. Sabal Yola from Yangon Wuban Hospital proposal to concept to the state councilors Da Aung Song, a way to reduce the number of times a patient and medical staff come into contact with one another. Now, this is good and bad because, yes, while the robots can do a lot of these tasks, the part about seeing the nurse every now and then is people to people contact, right? You can become overwhelmed with loneliness and depression if you never see anybody. So that's the only side effect I worry about this. Maybe if they can put a video camera where the nurse can talk to them or something, that'd be a little nicer. We mainly aim to reduce the instances of contact between patients and medical staff using this robot, said Dr. Fa, who directed the inventions of the trolley robot YTU. The doctor told the department that behind the robots began big business in order for the Education Ministry to work to assist the Health Ministry in combining the COVID-19 pandemic. On the Monday, the Education Ministry donated 3 additional trolley robots, as well as remote-controlled spray cleaning robot to the Health Ministry. The spray cleaning one is probably the one from Vietnam. The Education Ministry has also provided additional funding for the country's technological universities to invent more robots for hospitals. Well, this is another reason why many unemployed will never go back to work. Virus transmission rates would be reduced if we can reduce the instances in contact with patients using these robots, the medical superintendent said. The medical center was recently set up in Yongtong government on the site of the Central Institute of Hugu Township. The medical center has no patients yet, but is set up to accommodate 200 patients, with 2 hospitality currently treating the Convoy 19 patients. The Education Ministry has also donated a speaker drone that communicates messages remotely and the autopilot sprayer drone. The Health Ministry, the drones were also invented by the teachers and students at technology universities. Well, it's kind of cool. The past month, we've really got to see how students and universities actually make something useful instead of just spreading. This is what Mark Twain said. This is what Plato said. Or this is the year that XYZ happen. It's really nice to see students doing something. But anyway, what are your thoughts about these two new devices? And what are your thoughts about robots taking over hospital jobs? Yes? No? And what other kind of robot would you like to see? Like, comment, subscribe. Moving on to the last article for health. Hong Kong International Airport has started trialing disinfectant booth, which it claims to kill all microbes, including the microbe 19 virus, in 40 seconds. The airport is the first place in the world to use the clean tech sanction pods, which are currently being utilized by key workers such as public health staff. The interior surface of the cubicle is coated with an antibacterial material which kills any viruses and bacteria of humans is cleaned. And this here is a picture. It's basically like almost one of those porta potties. But I watched a little video on it. You will use a visual sensor. It takes your face picture, matches your face up. Then you walk in. It kind of uses compressed air and sprays you for about 40 seconds, and then you're done. So it's kind of creepy, but I guess it is effective. The individuals have their temperatures checked before entering in order to prevent fever or key warnings for the convoy 19. After stepping inside the enclosed booth, the disinfectant and sanction procedures being taken around 40 seconds to start to finish. In a statement, the spokesperson for the airport said the interior surfaces of the channel is equipped with an antimicrobial coating, which can be remotely kill viruses and bacteria on human bodies and clothing by using the technologicals and photocatalysis and the nano needles. Spraying sanitation spray is also applied to disinfect inspections. The tunnels are one of several measurings being used to try out at the airports to keep it free from germs. So what do you think about this? Would you use this daily? Not just the airport, but I mean, let's just say you go to Boeing or you go to any workplace that's inside closed workplace. Would you use one of these every day? Yes? No? Or do you have a different idea? Like, comment, and subscribe. Hi, the small clip you saw was brought to you by Loyal World News. If you like what you saw, you should subscribe and look up my daily Loyal World News report for its full version. If you don't want to watch it on YouTube, prefer to be on the road, I also have a podcast in every full-length video I put up.